My breast cancer patients present with really complex shoulder problems, but they want multi-plane shoulder movements to perform tasks like swimming, playing tennis, and doing those yoga poses where you really have to reach out towards the back with your arm. These arm positions go beyond the usual abduction and flexion. If problematic scarring, adhesions, and bracing behaviors are present, then these impairments are far more obvious in these really big stretches. Yet, researchers persist with using single plane range of movement shoulder tests, like shoulder flexion and abduction, internal and external rotation. We need to address the elephant in the room. All people after their oncology treatments have a scar response. It's normal human behavior in response to an injury. The severity of the response can be a big range from minimal to severe soft tissue changes. This means that scars, adhesions, and bracing behaviors must be considered as risk factors when investigating chronic oncology side effects like pain, movement disorders, lymphedema, weakness, and shoulder dysfunction. As allied health and exercise professionals, we have been complicit in neglecting scar severity as a risk factor because we haven't developed great assessment tools. The POSAS has been used in some oncology studies, but this tool was developed for burn scars. And so it only gathers information about the scar on the skin. Cancers are often located well under the skin. And so the surgical removal means the scar extends from the skin to the site of the cancer. So using a burn scar tool means neglecting all of the scarring under the skin. Health professionals, exercise professionals, and researchers need better scar and adhesion testing methods to measure the severity of oncology scarring. Hi, my name's Denise Stewart. I'm an occupational therapist and have worked in breast cancer rehab for well over 30 years. In this presentation, I'll review the features of an oncology-specific scar severity tool called the myofascial adhesions for patients after breast cancer. The Belgium MAPBC researchers have done a lot of work on this oncology scar assessment. We can follow their lead, we can jump on their shoulders and develop scar assessments for areas like head and neck and melanoma. I will also report on how I've adapted this tool for my clinical use. See you at the conference.